Senator Blackburn.
Thank you so much, Mr. Chairman, and thank you so much for being with us today. And I have no doubt that you will be confirmed and you are going to do such a solid job for the people of this country. And I do have several issues I wanted to talk with you about and didn't have time to cover them all when we met prior to the meeting, but rural health care is very important to me and the people of Tennessee. 78 of our 95 counties are rural counties. Now, over the last few years, we've seen hospital closures. So we have focused on access in rural areas. And my rural health agenda, which is bipartisan, focuses on innovation, telehealth, access points. It focuses on work shortages. And also, Senator Warner and I have together focused on making certain that we address the area wage index and do that fairly for our citizens that are in rural communities. So I would like a commitment from you that when confirmed, you and your CMS administrator will work with us to make certain that the area wage index is balanced and that it is fair to rural areas.
Senator, both Dr. Oz and myself recognize that rural health care is in crisis in this country, and that is catastrophic for our entire country. And I talked a little bit about my commitment to rural health earlier in this hearing. The regional price points, as you know, are set by Congress and not by HHS. I will certainly, and I know Dr. Oz will certainly work with you to make them sensible.
We look forward to that. Also, you and I, before you came forward as the secretary, the nominee, we had talked in years past about over-medicating youth and concerns over that. And I was looking at a report from TennCare, which is our Medicaid program in Tennessee. And I was concerned when I saw a number that TennCare had spent $90 million in 2024 alone on ADHD. This was 417,000 of our children. And $90 million. To me, that is heartbreaking, what is happening there. So how will you prioritize oversight of prescribing practices while promoting alternative solutions such as counseling, behavioral therapies, community-based interventions for our youth?
Exactly, and that's the solution. 15% of American youth are now on Adderall or some other ADHD medication. Even higher percentages are on SSRIs and benzos. We are not just over-medicating our children, we're over-medicating our entire population. Half the pharmaceutical drugs on earth are now sold here. 70% of the profits from pharmaceutical companies are from the United States, even though we only have 4.2% of the world's population. Not only that, but a recent study by Cochrane Collaboration founder Peter Ghosh found that pharmaceutical drugs are the third largest cause of death in our country after heart attacks and cancers. Oh, they're not making us healthier. We need community health initiatives. We need access to treatment. We need exercise. We need better food.
Okay, let me talk to you about one of those access points in treatment. And this highlights a problem we have in the federal Medicaid law. Since Medicaid's enactment, states have been prohibited from using Medicaid funds for care provided by institutions for mental disease. We refer to them as IMDs. These are psychiatric hospitals, residential treatment facilities with more than 16 beds. This is a discriminatory exclusion, and it denies payment for medically necessary care based on the illness that is being treated, and it has perpetuated unequal coverage in mental health care. So if you're confirmed, when you're confirmed, will you commit to working with me on repealing this discriminatory exclusion and ensuring equal access to mental health care for Medicaid beneficiaries?
Yes, Senator.
Thank you so much. I've got a question on PBM reform, one on artificial intelligence in healthcare. In the interest of time, I will yield back. I look forward to seeing you help make us healthy again.
Thank you, Senator.